is the approval of our, can you make the screen bigger? Is there any way to make it bigger? Or is that just me? Is that just the way I'm viewing it?
You can zoom in on the right side. It should have a vertical option for the plus sign.
Is that, are you talking to me or the director?
I was mentioning you. Yeah. You can zoom in whatever you're seeing.
Yes, yes. Thank you. I tell you, I'm learning this along the way. I appreciate it. Okay. With that, it seems like I've gotten too big and I've kind of, alrighty, let's, can we go back to the, yes, there we are. That's what I'm looking for, the agenda. Okay, so the first, may I have a motion? Hopefully everyone has had a chance to look over the agenda. May I have a motion to approve tonight's agenda?
Motion to approve.
Seconded.
Okay, all in favor?
Aye.
Okay, anyone doesn't approve? Okay, very good. So we have the agenda for tonight. The second is, hopefully everyone has had a chance to look at the minutes for the August 18th meeting. May I have a motion to approve the agenda?
Motion to approve.
May I have a second?
Second to approve.
All in favor?
Aye.
Aye. Aye. Very good. Anyone not agree? Very good. Motion to approve. Hopefully everyone has had a chance to look over our special meeting that we had on October the 9th. Okay, good. May I have a motion to approve the minutes for the October 9th special meeting?
Motion to approve.
May I have a second?
Second.
All in favor?
Aye.
Very good. Motion to approve sustains. The next is a motion to approve the bad debt write-off. Ms. York, are you going to present that first, or do we just?
Yes, ma'am.
Okay.
On page 8 of your packet, you have bad debt write-off number 61, dated October 20th, 2020. We're requesting the board approve write-off of $53,480.92. Of course, any balance over $50 for each patient will be sent to the North Carolina Debt Set-Off Program. And I'll be happy to answer any questions if people have any in regards to it.
Does anyone have any questions? If there are none, can I have a motion to approve the bad debt write-off?
Motion to approve.
May I have a second?
Second.
All in favor? Very good. Okay. Aye. Okay. So now for the agenda, can you put up the agenda again? Okay, very good. So now do we have any public comments?
Dr. McMahon, we do have to approve the closed session before we go.
Oh, we do have to approve that? Oh, okay, I'm sorry. Okay, we just don't talk about it. Okay. Okay. No problem.
We have to put it on the agenda to the top under an action item. So we do need the board's approval to go into a closed session before we move, if you don't mind.
Okay, sure. Could I have, so tonight we're going to discuss some personnel issues, and we're going to do that with a closed session. Can we at least just have a motion to approve that, to have that as the last thing on the agenda?
Motion to approve.
Second?
Second.
All in favor?
Aye. Aye.
Very good, very good. Okay. So we have,
There's one more item. The second part of the bad debt write-off is the approval of the fee policy. One item.
We can go back to that. Yes, yes, I see that. We can go back to that. Ms. York, did you want to present that?
Yes, ma'am. On page 13, on section 6 of procedures, item E, we're just adding a statement there that staff will actually recommend that all uninsured patients apply for Medicaid coverage. We are already doing that practice for any patient that comes into our clinics, but as a recommendation and our administrative monitoring, they want it actually written out in the policy instead of just the procedures, and so we're just adding a statement here for that's the purpose.
Yeah, okay. Yeah, I remember reading that, something over and over about that. They kept on asking about that. Sure, that's no problem. Can we have a motion to approve that statement? Staff will recommend all uninsured patients to apply for Medicaid.
I'll make a motion.
Approve.
Okay, we have a first and a second. All in favor?
Aye.
Approved. Okay, so next, Ms. York is going to present the financial reports and budget update.
And on page 14, you have your financial reports for the month ended September 30th, 2020. At the close of the month, our revenue exceeded our expenditures by $53,059.18. On page 15, you have the monthly
Can you
expenditure
go back
report.
to that, Ms. York? Can you go back to that? So you're saying that, okay, so for the month, we had a 53K surplus?
Yes, ma'am. We just have more revenue.
Yeah,
Yeah.
I was wondering, what is this 500 deficit, 500K deficit?
Well, that's for the month, but the year to date, actually, our revenues exceed our expenditures by the 53,000. But for the month ending, there's a deficit, but there's 3 payrolls that were reported for expenditures. Of course, we get paid every 2 weeks, so of course, there's always 2 times a year that there's 3 pay dates charged out in a month versus 2, and so that just made a little difference of the month to date, but the actual year to date, our revenues are expenditures by $53,059
Okay,
overall from July through September.
okay. Alrighty, I was just curious about that. I said, wow, big difference. Go ahead.
Okay. On page 15, you have your expenditure report broken down by program. At the close of the month, we had expended 18.72% of our budget. Of course, a fourth would be 25%. As always, it's just going to be time and some expenses and also vacancies that we have that we're filling. We'll never actually probably ever be at 100% of our budget due to vacancies.
So I saw that like the opioid grant hasn't been used. Is that because of what?
Yeah, we actually had just filled that position. In fact, the employee will start on Monday, actually. So you will start seeing some expenses in that category.
Wonderful.
And if there's any other questions about any of the other, I'm happy to answer those as well. The child fatality prevention, for example, nothing has been set there. That can be driven by the child actually need and determination how those funds will be expended. And so throughout the fiscal year, sometimes they will give us a list of items to purchase of those funds. And it'll be based on their studies of child deaths and what they can do to help prevent child all that deaths are counted. Moving on, if there's no additional questions, begin on page 16 is the revenue report. First category is our state and federal allocations, followed by our grants. Page 17, our Medicaid and fee collections. At the close of September, we have actually collected 23.3% of the budgeted Medicaid revenue, which is pretty much on target. Like 100%, of course, it'd be 25%. And fees were at 21.0%. Not too far off target there either. And then, of course, 18 shows the total, which reflected that overall 18.96% of budgeted revenue through the close of September. On page 19, you have your accounts receivable report broken down by year type and program. And finally, on page 20, you have your private pay uninsured agent reports broken down by program. If there's any other questions, I'll be happy to address those.
So Ms. Thomas is going to present our Cumberland Adolescent Parenting Program.
Good evening. My name is Ann Thomas from the Adolescent Parenting Program. This program, this program is a free program for Cumberland County. We address the needs of parenting and pregnant teens under 19. One of our goals, our goals are to educate, empower, and encourage them. So we do case management with them. The goals of this program is to strengthen employability skills in an effort for them to become economically self-sufficient, to prevent that second subsequent adolescent pregnancy while they're in adolescence. We provide and utilize resources in the community for them. One of the goals is for them to remain in school until graduation. We help to stabilize family support and improve their parenting skills. Their eligibility, they have to be under 19 the day before their 19th birthday to actually close them out from the program. They have to be parenting or pregnant for the very first time. A second pregnancy would certainly terminate them from the program. They have to be enrolled and engaged in school because the goal is to complete high school. They have to be a resident of Cumberland County and willing to postpone that second pregnancy after adolescence or after they're out of high school. There are 16 high schools in Cumberland County. The adolescent parenting program, I service at 11 of those high schools with pregnant or parenting. Our referrals usually generate through the hospital, Cape Fear Valley Hospital, the pregnancy care management at the Cumberland County level, CMARC care management for at-risk children, social workers, school nurses, other team participants, and even their parents refer them to this program. And we also work with the postpartum home visiting program and some of their primary care providers make referrals to this program. August and September of 2020, as of August and September, after the last school year, we have currently 15 participants. So last year, the overview for graduation, we had 10 graduates that were honored. we had 10 graduates honored in the graduation ceremony. 7 of them participated and we delivered their graduation items to them. Partner with other community agencies. And those agencies turned out really well for us. They provided gift bags. A couple of agencies worked together to create t-shirts. We had a photographer to come over and do a photo session, and we provided a box. This is one of the t-shirts that the Cumberland County Health Department provided for us as a gift to the graduates, promoting those. One of the other agencies has provided face masks for us for the teams. I think we're having Okay, let me just tell you a little bit about the girls that are in this program while they're working on that issue. Right now, I have a total of 15 participants. I usually have anywhere from 20 to 25. Some of, but I do utilize interns from the local colleges and volunteers.
Hi, if we can, if everyone can mute their line, that will help us hear the better. Thank you. Sorry about that.
We use two curriculums with this program. Both of them are evidence-based and evidence-based curriculums. One is parents and teachers, and the other is called B3. We partner, facilitate, and reflect with the clients. The approach that we work with the families are parent-child interaction, development-centered parenting, and family well-being. So we're dealing with our children, our teenagers, and their child development, as well as the development of their own babies, getting them to understand the different levels of development and how to react and how to be better parents. We implement these models one-on-one home visits, and now doing tele we have peer group meetings. I usually do them every quarter before COVID.
Hi, everyone. Just one more reminder, we're trying to, on our side, trying to mute everyone. But if you are not muted, if you can please mute yourself, that will be able to help us to hear everyone. And I don't know that we are able to do that for you. So if you are not muted, please go ahead and mute yourself.
Thank you.
Thank you. We have IT in the background working, so thank you, Daryl. I appreciate it.
So we do the two models, the parents as teachers, that we focus on parent-child interaction, development-centered parenting, and family well-being. And they got my screen back up. So this was an APP canvas bag. We purchased the bags, but one of the other agencies, Family Services of America, embroidered the APP on it, and they also provided us with the face mask for each graduate. This was a joint venture from Falcon's Children's Home, donated by Ms. Perea from Royal Homes of Falcon. And this was a t-shirt that was given to each one of the graduates this past school year. This is one of our graduates, and she gave us permission to use her image. She was an Alger B. Wilkins graduate. She worked really hard. I will be a little transparent. I terminated her from the program for not participating in school, but she quickly got the message that she had to stay in school. She went back, she got her high school diploma, and right now she's enrolled at Fayetteville Technical College. Currently, this says 14 participants. I actually have 15, and this is the breakdown of the schools and where they are. For the most part, I only have 3 12th graders this year, and I have 4 11th graders, 4 10th graders, 3 9th graders, and 1 8th grader. We also implement a model, B3, be proud, be responsible, be respectful. And this is a 2-day, 4-hour each day module, and it's 8 modules where we go through sexual health, making proud decisions, avoiding risky behaviors and risky sexual behaviors to eliminate that second pregnancy. We also talk very detailed about family planning. We encourage the girls to get a family planning model before they give birth so that they can avoid that second pregnancy and possibly or graduate from high school. So what's happening now is I'm doing very few face-to-face office sessions. If I can socially distance, I will have them come in, but mostly Zoom sessions. And if there are needs of the client, we will drive them by. their home and drop them off on the front porch or in the mailbox. This month, there are a lot of campaigns going on. A national campaign for healthy babies, dental hygiene month, sudden infant death syndrome awareness month, hunger awareness month. I've tried to incorporate all of these topics and these concerns and issues into our program. So a couple of the agencies that work with me provided toothbrushes and toothpaste for both toddlers and adults. And we also have the mouth swabs for little babies. The SIDS, the department WIC has donated This Side Up to promote safe sleep for the babies. Healthier Hunger Awareness Month, we're collecting one canned good to be able to distribute to our families at Christmas time. We also have awareness, breast cancer awareness. Another agency donated shower hangers and 8 pins. So this year we're giving both the teen and her mom a shower hanger to remind them of the awareness of breast cancer and check their breast. I just want to give you a few statistics about Cumberland County and where we fall as it relates to teenage pregnancies or unintended pregnancies. The latest statistics I have are from 2018. We don't have any for 2020 yet, but the total number of pregnancies in 2018 was 8,390. That was 2018. How we stack up, we're number 18 on that list with 379 pregnancies in 2018. And that is from ages 15 to 19. In that bracket of 15 to 17-year-olds, we had 72 pregnancies that year. And they break down, we have a breakdown by race, but pregnancy sort of, it crosses all racial lines and socioeconomic lines. And so we're just trying to be there for them and provide supports for their family, for their babies, and for the moms to do better and be better parents. Any questions?
All righty, fantastic. Thank you so much for that presentation.
And congratulations to the graduates.
Can you repeat that question?
I said congratulations to the graduates.
Oh, thank you. Thank you. We have quite a few agencies in Fayetteville that do partner with us, and they're very, very supportive. And every time I ask them for anything, they're always there, supporting, provide resources. Partnership for Children is one of our resources. Falcon has provided homes for some of the young ladies. There's a village, and she provides diapers. So we have a vast community of partners with adolescent parenting program.
Thank you so much. I appreciate that. I'm sure that was very enlightening. I didn't realize that there was such a program. Okay. So now Ms. Curtis is going to present our public health accreditation training, Benchmark 38.
Hi, everyone. This is Ashley, the Deputy Health Director of the Health Department. We're going to go over Benchmark 38. There's a few different activities within this benchmark, so I went ahead and created a PowerPoint for you all to send out after the meeting. Benchmark 38 is the local health shall in the establishment of public health goals and objectives. So as you can see here, activity 38.1 talks about annual review of reports provided by the local health department on community health. We have to do one for each year since the previous site visit. So that's 2017, 18, 19, 20, and 21. You'll see in red there, that is a change that they made due to COVID. Submission for this activity is only one report for 2020, but for every other year, we need 2 annual reports. Next slide, please. So something to note here, this one is not talking about the CHA, SOCH, or annual reports. Those will come in a later activity, but it is talking about things like environmental health reports, county health rankings that we just did in August, and maybe flu incidence reports. Next slide, please. Activity 38.2, this is when we're getting into the SOCH and the CHA. SOCH meaning State of the County Health Report. CHA is the Community Health Assessment. For activity 38.2, local Board of Health shall review community health assessment data and citizen input used to plan and monitor progress towards health-related goals. So documentation A is specific to the SOCH, and so that's for every year that a SOCH was conducted. And then for documentation B, we're talking about the community health assessment and every year that that was conducted. Next slide, please. So when was it conducted? For A, the SOCH was conducted in 2017, 2019, and 2020. This should really discuss data that was found in the SOCH. For B, it's talking about the CHA, and that was conducted in 2018, and we're getting ready to gear up for more data collection in 2021. Something to note here that I bolded, this needs to be for the CHA, documentation B, a review of data and citizen input. So we have to provide a reflection that the public participated in the CHA. Next slide, please.
They do that anyway, don't they? I mean, are you saying that they need to be at our meeting?
So this is specific to, that's a good question. This is specific to the Board of Health. So we would have to show that we brought the data to you all and that the public had an opportunity to comment on what was found in the CHA. So citizens participate in the data collection. We do focus groups and surveys to get the information. But then on the flip side of that, once we publish the report, we also need feedback from the public. So that can be done via email, via your Board of Health meetings, whenever that happens, or we can also do surveying at the tail end of that.
So we're gonna have to do with some kind of call out when we present it at, when it's presented at our meeting. Is that what you're saying for public comment?
Yes, ma'am.
Okay.
For activity 38.3, local Board of Health shall assure that the individuals, agencies, organizations have the opportunity to participate in the development of objective strategies for community health improvement. Next slide, please. So for A, this can be things, so for A, it's looking for your Board of Health policy regarding broad community collaboration, which I believe is housed in your operational procedures. So we would submit the operational procedures for A. For B, this is specifically talking about meeting minutes where we're showing that they participated in a public comment. And it can be in regards to any project that is related to community health improvement. Any questions?
I mean, we always have the opportunity for public comment. So are we satisfying our goals?
If we, so the generalized public comment that is offered at each meeting, I don't believe would satisfy this benchmark. It's more so that we put out for something specific. So we're looking for public comment on something specific. And that may be the CHA or the SOCH or some other project that the Board of Health is spearheading.
When we do our next, as Ashley mentioned, we're going to start our next year data collection in 2021. So that's something that we will assist the board with doing, is making sure that we are giving specific invitations for the public to make public comment on the CHA so that we can meet this benchmark as a part of that process.
Okay, that sounds good. Thank you.
you.
Madam President? Hello?
Yes, please,
Okay.
comment.
Listen, I might have to be excused because I've been paged to come in the patient's room, so I'm gonna have to be excused if that's all right. This is Sonia.
Thank you so much for joining us. We appreciate your
Okay,
participation.
thank you. Be
Thank
safe.
you. Thank you. Alrighty, now we have, Dr. Green is going to present an external report.
All right, so we have 3 external reports this month, and as we've said in this meeting before, this is really an initiative that has been started by Mr. Holder when he was the interim, to make sure that the board is aware and the public is aware of any external reports that we receive about our programs. And this is in an effort for transparency, both for the board and for the public. So this month we have 3 external reports and audits to share. One is from our breast and cervical cancer control program, and this was our consultation report that we received. And you can find that on page 21 of your packet. And you can see in the report that we did not receive or did not have any corrective action as a result of that technical assistance visit. So we met our expected number of targets. So you can see the percent on the last column on the first page, expected percent of targets that we'll meet for a number of patients, and we've met that. We don't have, there are some comments that we have outstanding cases that need data cleanup, and we've done that. And there's a note here that many of our clients are being served via telehealth, and that we're not open in full capacity to the public, so that we are helping to meet that target.
I have a question about that comment. Was that to be perceived as an okay comment that we're doing telehealth? Because I was just wondering, was that satisfactory to them? Because
Right.
I mean, just the nature of screening exams. I mean, it's all about breast and cervical exams.
So we did not have any deficiencies for that reason. I think they were just noting that this is how we're providing services. And early on in the pandemic, they gave some guidance about how we might be able to implement telehealth services with that program. On the next page, it shows our expenditures and that we were in our funding, and that we were meeting our benchmarks for the number of funding based on the number of women that were served. And that in the next, in section 3, this is our performance, clinical performance indicators. And this shows that we do have a tracking system in place. We have our audit conducted. We do regular QI, and that we did patient navigation for anybody that received abnormal results, and that we do assess for social determinants of health. And so you can see that we've met those performance indicators there. So overall, we did not have any corrective actions to make for this program, or no deficiencies were reported. So they gave a good review of that program. The next report is for our administrative monitoring report. So this is a little bit longer report, but I want to draw your attention to the pages that show our recommendations, and that is on page 27 of your packet. And there are 3, we did not receive any corrective actions for this audit as well. Candy and Colette did a great job of pulling together the audit. It was a virtual audit that they did with our program. So we sat with them for a half day to get this information together for them. And so we did not have any deficiencies and no corrective actions. And you can see on page 27 of your packet that they had some recommendations, but these are not required, but just recommendations. So the first one on page 27 is recommendation item D1. And this is what Candy mentioned earlier today, is that we have the practice of referring patients to Medicaid, but wasn't stated in our policy. So tonight the board rectified this and added this to our fee policy. The second recommendation on item E4 is that we don't require, or we don't currently deny anybody services based on inability to pay. And it was recommended that we put this in our policy. Our policy currently states that no patient will be denied services based on inability to pay. And so we do have that in our policy. Their recommendation was that we state that women and children don't have, such as our maternal and child health services, that they won't be denied. But our policy is actually more inclusive than the recommendation already, because it says that no patient, regardless of what program, or at least no patient in the, well, not just maternal and child health services. On recommendation item E6, there's a recommendation about the modifiers that we use. And this is really a recommendation at this moment we can't meet because of our electronic health record. But the modifier that they're recommending we use is added already by our billing staff. So that's already being done, but just in a different way. And then the final recommendation is on page 28, and that's recommendation F3. And this is, they make a recommendation that we have a procedure in place of identifying aging accounts. And we already have this written out in our billing guide, and that billing guide is for use by our internal staff and for reference for patients. And we do have written procedures in place. So we don't need, we didn't feel like we needed to add it into a policy because really it's a procedural thing and not a policy thing, but it is in writing already. And that is available both for the patients and staff to use as a reference. So that's our administrative or monitoring report. Again, no corrective action and no deficiencies. The final report that we have is our child health accreditation letter. And so this is an accreditation letter that we received, and you can find it in your packet on page 30. So when actually, when our site visitors come for accreditation, we'll need to be able to provide them this letter. And so you can see on page 31, the date of the visits that we've had related to child health and the summary of the performance. And you can also see that we had all requirements met for this particular program. So no, for all three of our corrective action reports, or for all three of our external audits, we didn't have any corrective action that we needed to make. And any questions on those three external audits?
Sounds good. All righty, now we're moving on to the director's report.
Okay, so you'll have a set of slides. I have a couple things we want to cover tonight. One is to provide a COVID update, so we'll start there. And I think we're getting slides back up. Thanks, Kelly. So overall, we are seeing an increase in numbers of COVID-19 cases in Cumberland County. The yellow line here shows our trend line, our 7-day rolling average in cases. And this is pulled down from the North Carolina Department of Health and Human Services dashboard. It's actually pulled this down on Sunday, but the data hasn't changed much over time. So you can see that in the last, at the very right side, over the last 7 or 10 days, we've had an increase in cases. And so that's certainly concerning to us. And our cases here, we actually, as of today, have more than 6,500 cases. And so our numbers keep ticking up and are rapidly increasing in Cumberland County. And this graph shows our positive molecular PCR test as well as our antigen test. The next slide shows the breakdown by race, ethnicity, and by age. So as with the beginning of the pandemic and with the rest of the country, we have a disproportionate number of African Americans in our community that are being impacted, and a disproportionate number of Hispanic individuals as well. The most of our cases are among those that are between the ages of 25 to 49, so that hasn't changed much over the course of the pandemic, or at least in the last couple of months. That's been the largest group impacted, although I'll point out that we do have 8% of our 0 to 17-year-olds have been impacted, and between our 18 to 24-year age group, we've had 18% of our individuals impacted. On Friday, the State Health Department added some additional data to their dashboard that I think is useful, and this data is available at the county level. So now their dashboard shows how many cases we've had in the last 7 days, how many we had in the last 14 days, and what is our, and we can standardize each of those number of cases by population size so that we can do a little better job of making comparisons between us in Durham or other areas in the other counties in the state. So in the last 7 days, we've had 380 cases. And I pulled this data down yesterday in preparation for today. So it's a little bit updated by just a day or so. And then in the last 14 days, we've had 709 cases. On average, we have 56.7 cases on average. And that data point is from the Harvard Institute for Global Health. They do a similar metric, so you can see over time, on average, how many are you having in a day, and is that increasing? So we've seen an increase in that number. Last week we had 40-something cases on average a day, so that's jumped up. And then we can also look at our cases per population size, and we for every 100,000 people, we have about 16.9 cases per 100,000 people, and that's a 7-day moving average. We get a lot of questions on the next slide about our case positivity rate, the percentage of tests that come back positive. Our target is 5%, as indicated by the World Health Organization, and we are at this afternoon at 5.9%. So the good news is, while our cases are going up, we do have some declines in our case positivity rate. And of course, that's a reflection of our testing in our community. So the State Health Department has set a target for us that we test, and not just us statewide, or each county, that each county tests 5% of their population every 30 days. And so that works to be out to be about 4,200 tests every week. And then the chart or the graph on the right, you can see week over week how many tests have been performed in Cumberland County. And right now, the last couple of weeks, we've hit that 4,200 target week over week. So that's a good thing. Although I'd like to see more testing done, particularly free testing. The next slide shows recovery data. And we've been a lot of questions asking for recovery data, and it was really challenging to be able to get an accurate assessment, but we think we've got it as close as we can. So we are starting to report this out on Tuesdays in our Tuesday press release, and we pulled the data down on Friday to give us time to calculate it over the weekend. But we define recovered, and we say presumed recovery, as 14 days after their test date, or 28 days since their test date if they were hospitalized, or if we don't know their hospitalization status. And that is the North Carolina Department of Health and Human Services definition. So currently we have 5,700 people that have been recovered, and 574 active cases, and 97 of those, and 97 individuals that are deceased. If we look at our death data, most are older adults over the age of 65, most are male, disproportionately African American, most have been hospitalized, but not all, and most had some comorbidity, heart disease, lung disease, pneumonia, something else going on. And 51% were living in a congregate living setting. And I think a lot of people think, well, that's probably that number is probably higher, but that means for me that a lot of people aren't in nursing homes that are passing away. There are some folks that are at home, presumably healthy before this, that are also dying. Two quick new initiatives I want to tell you about. The State Health Department has launched some regional prevention support teams, and these are teams that are going to support our long-term care facilities prior to an outbreak. So once they have an outbreak, the health department steps in, we handle the outbreak and respond. But before, the long-term care facilities really need some help and assistance to prevent outbreaks from happening in the first place, and produce the reduction of disease. And this is COVID funding that's funding this initial effort, but the State Health Department has given us some direction that this is going to go beyond COVID, and that we'll have funding to support this effort regionally for other infection control measures as well. So it's a regional effort. We are in Region 6 with Polk County, Harnett, Moore, and several others. And the state has funded 4 positions. They're temporary positions for us at the moment. And 1 coordinator and 3 trainers to support our region. So we have 3 of them have onboarded already, and we have 1 vacant position that we're trying to fill. So we're excited about that. They're housed in Moore County, but Cumberland is the fiscal agent for that. So we're sort of the oversight of the grant, but even though they're housed in another health department, but we have regular communication, daily communication with them. And then the next update I want to give is about our COVID vaccines. We get lots of questions about this. The state on Friday updated their COVID vaccination or submitted their COVID vaccine plan to the CDC, and we can share that out with you, or the link. It's a publicly available document. Yesterday, the health department submitted our vaccine provider agreement to the state health department that said we will submit vaccine, that we will help administer vaccine when it becomes available. And the hospital did the same, I believe, either yesterday or on Friday. So they submitted theirs as well. So the first rollout of vaccine will go to the hospitals and the health department to roll out vaccine to the community. In their plan, the state health department has identified phase 1, and we know in phase 1 we'll have a limited supply of doses. I don't know when that will be, but it will be a limited supply of doses, and we will, their priority populations are critical healthcare workers, which includes public health staff that will be helping to administer the vaccine, essential workers, specifically emergency management, fire, first responders, our long-term staff, care staff, and residents, our congregate living, those that are in congregate settings, our migrant farm workers, our homeless, our incarcerated individuals, and then also those workers that are in high density populations. So for example, if you work in a food processing plant. As you can imagine, this is more people than we would have doses for initially. So we've been asked to estimate some numbers and what the, how many people are in each of those categories. So we will submit that to the state tomorrow, and then the state will give us further guidance about how to roll that out once vaccine becomes available. But our team is meeting now and trying to collaborate with the hospitals so that we make sure that when we have the supplies that we need, so that when it becomes available, we're ready to go. I'll pause for questions there before I move to the strategic plan update. Hearing none. I'll go, there's a lot of content on these slides, so I will not read them to you, but I just want to hit the highlights. In your email, you should have received a spreadsheet that has a larger version and a more detailed version of this plan. This is something that our team has worked really diligently on. So I know you probably need to go through the spreadsheet and all the tabs, but we just want to provide a high level overview tonight and see if there's any initial feedback as we walk through this. So, and I just want to backtrack us just a little bit. So in February, the Board of Health met, your team met, and had a retreat and set some internal priorities for us and external priorities for us. And then the health department staff, we worked over the last several months to turn these priorities into specific goals, and then specific objectives, and then specific strategies. And so we're going to hit on the goals and objectives tonight. And then in the spreadsheet that you received, you can see all the strategies that we've come up with. So the next slide just reviews the timeline and activities that we, so we can remind folks where we are. So tonight we're meeting that metric that says we're going to present our goals and objectives to this group, the board, and anybody that would want to make public comment or public input on that, we'll have that available for them as well. And then we'll go over next steps at the end. So just as a review, our team on the next slide, we established a strategic planning team after the board met in February. We got derailed by COVID, and then we restarted in June and July to develop goals, objectives, and strategies. Staff have also had an opportunity to see the spreadsheet that you received so that they could provide anonymous feedback on that spreadsheet and get their ideas. We took that feedback from staff and then reincorporated it into the spreadsheet that you received. So they actually received a slightly different version, and then now you're getting the updated version with their feedback incorporated into it. So let's jump into it. Again, I'm just going to provide a high-level overview, so I won't read every slide to you, but we'll send the slides out to you so you have them here for reference, and then you also have the spreadsheet. So under the first priority, the board wanted to increase our staff recruitment and retention and assess our employee satisfaction and morale. So our first goal is around employee satisfaction. So you'll see our objectives are really centering around measuring that employee satisfaction and and employee morale, and we'll do that through a staff survey that we'll create. And we want to work on a couple of things specifically working towards morale. And one is that there's effective communication between an individual and their supervisor, and then effective communication between the individual staff person and the senior leadership team. So we want to hold ourselves accountable as well. And then also effective communication between the department, each of the health department programs. And then we want to also make sure we're being proactive about doing that, and that we, that the senior leaders of the health department and our management team staff, anybody that's in a supervisory role will attend leadership training. We already offer that for many of our staff, but now we want to track that and make sure that that's happening.
So the big thing that I was wondering about with a lot of the goals was just the timing of it. So I thought that the year began July 2020 through June 2021. Why are these dates 2022?
So, and remember the board, we were doing a 2 to 3 year strategic plan. So when we get into the strategies may not take, the specific activities that we're doing will roll out before 2022, but we want to be able to roll out the strategy, get a baseline, and then these are our targets that we meet. So even though it is, we're rolling, we won't really be able to start working until January 2021 on these after we get final approval from this group. And so we really have a year or so to really move the needle. So especially on some of these that are longer term, you'll see throughout the spreadsheet, it's going to take some time to move the needle on that, but that doesn't mean the work is not starting until July 2022. We're going to start it now, but we want to take some time to make sure that we're actually making measurable change.
So how does that work out as far as our yearly retreat though?
Yeah, so you set the priorities for us. So on the yearly retreat will be an opportunity to help us to refine some of the goals. We'll still do the quarterly updates for the board, but your yearly retreats might focus on what strategies need tweaks, what goals and objectives need tweaks, what things do we need to add, what things are no longer prioritized. So we'll kind of refine and reassess some things, but we're not going to set whole new priorities every year. I think what we talked about in February is that it's really challenging for us to meet some of those goals in just a year's time, or really less than a year's time once it's all approved, to actually make meaningful change. So while we stretched out the time, but we'll be able to go back to the board and show you progress on some of those things that we've been working on.
So pretty much the whole nature of our retreat is going to change from here forward.
Yes, so you'll still be able to, so instead of setting priorities every year, we'll set them less frequently, but we'll still provide, the board will still have an opportunity to provide feedback about the goals and objectives and where we want to focus on. Maybe we want to take this one off, it's not any longer relevant, or we really stalled out on this particular goal or objective, we're not making progress. So having feedback and input that way, but this just gives us more time to be able to work on those items.
Okay.
So the next goal is about, under priority 1, is about staff recruitment. And so we know that staff recruitment is a challenge for the health department. So these objectives are really centered around making sure that we are being intentional about our recruitment events, we're attending our recruitment events, and then measuring our vacancy time so that it's no more than 3 months from the time the position has been vacated, making sure our supervisors are interviewing well and that they're trained on interviewing, and that they do that every well so that we're in compliance with our federal laws, but also that we are interviewing smarter. And then also making sure that we're getting a diverse set of candidates that we have reviewed. And we've actually already started on this because in July, we started doing a blind application process. So you'll see some of that work in here as well. Goal 3 under priority 1 is about not having as much staff turnover, and it's really about retention of our staff. And so we want people to to remain in their position. So for our staff, this really was about salary and making sure that our salaries are competitive to the extent possible. Making sure that we do check-ins with our staff after they've been hired so we can assess early if something is going wrong. And then making sure, really the measure for that is to make sure that 85% of our positions are filled at any given time throughout the year. So that's something that we know is going to take time to get our positions filled, and then making sure that they're staying filled. The next two goals under priority 1 are about transparency and objectives. In performance reviews, we heard a lot of feedback that people don't always feel like their performance review is objective or transparent. So this will help us because we're getting a new performance management system or performance review system called Perform, and we're going to roll that out and go live in January. So this one is set for 2021, and we can get feedback on that earlier. Get feedback about the performance review system. And then the next one is about staff training. We have a new, along with Perform, we have a new learning capability system. It's called Learn, and that is our new system that will roll out for training and will allow staff more access to training. The next priority is about quality and efficiency. So Ashley and the QI team have been doing a lot of work around QI. And so this first one is really about using the EHR and making sure that staff are onboarded into that, reducing our no-show rates in clinic, making sure that our clinics are meeting their target numbers of clients served, and then also reducing wait time on the clinic floor. The next goal under priority 2 is about access to services with our EHR. So we want to make sure, we know that mental health is really critical to the board. We want to make sure that those that come in our building have a mental health referral if they need it, that we increase our participation rate in WIC. We've seen that increasing over the last few months with COVID, but we want to make sure that we're meeting those targets. And that we are implementing NC Care 360, which is the statewide referral network that is going live in all 100 counties. And then we also want to use technology to make sure patients can schedule appointments online if they would like to. The final goal under that priority is about our efficiency of our internal processes. So how we pay for medical records or pay for our environmental health fees, making sure that that's online if folks need it. And then also in this group, we've talked about our death records and processing death records more quickly. And so the state rolled out just a couple of weeks ago their new system for death records. In other counties, we're in, I think, phase 2 or 3 of that. So we're not doing that yet, but that will help us with efficiency there. And then environmental health is also getting a new go live date, a new electronic platform called InterGov. So that will also help with the efficiency of services in environmental health. Priority 3 is about social media. So there are a couple of goals under there. And the big goals are about getting a social media team and then utilizing our social media platforms better and having each team, each program have a plan for using social media. And then you can see some metrics how we'll do that, increasing across our social media platforms. So we'll jump to our external priorities. This one, the first priority is really about building partnerships. So you're going to see some more of our regional work reflected here. So the first goal was really to think about who else do we need to partner with, who are we not reaching, and then doing some focus groups with partners to identify who are we not reaching and joining some new coalitions. The second goal was about, okay, we know we need to get new partners, but what about our current partnerships and how can we support that work with our current partners? So you'll see some objectives here about Triple P, Pathways for Prosperity and partnering with them. And then also doing our tobacco project and partnering with the Military Health and Readiness Initiative to address tobacco use in the military. So those are all current projects, but we really want to build those relationships better. The second priority under the external was the board set was about mental health and substance abuse. So we want to do a better job of making sure we have in-house substance abuse services. And so I know this team at the retreat talked about having a psychiatry resident. So we want to explore that option. And then also having in-house substance abuse. And by I mean in-house, on site, not necessarily provided by the health department, but that we would have somebody in the building on some regular cadence to provide mental health services and substance abuse services. The second goal under there was really about increasing referrals. And so we want to make sure all of our programs are trained about how to do referrals for mental health, when to do them, and then increasing referrals also to the quit line, because we know substance abuse is a really key, or tobacco use is really key to and correlated with substance abuse. So making sure that we get referrals to the quit line as well for our behavioral health providers. That's a goal.
I was wondering about stuff, because that has come up a couple of times. A lot of times your EMR can flag, you can program your EMR that if certain diagnosis comes up, that it can cause a flag to the provider and to note, please refer.
That's a really good strategy. So I don't think we have that strategy on ours, but as we implement and roll out our new EHR, that's something we'll definitely discuss with the vendor, making a note to flag mental health. And then what we can do is if it gets flagged in the EHR, then refer them via our NC Care 360. Thank you. That's a great suggestion. The third priority from the board external priority was to expand communication and outreach, especially with our schools. So this one is a little more challenging to think about how do we measure this, but we really wanted to make sure that we are making sure our health department is helping other people with their literacy efforts. And so making sure that our nurses have access to the language line and at school settings, that even when they go back in person, that they'll have that access, and that we also provide information about chronic disease for community members to access, and then that we really do a check on our own materials to make sure that they are considered health literacy as well, and then that we assess that on our community needs assessment. So you heard Ashley talk about the CHA. So when we start collecting data in 2021, we want to make sure that we are collecting data about health literacy as well. And then finally, the fourth priority here was about expanding access to community services. So this is one I'm really excited about. We want to change the perception of the health department and make sure we want to assess that to see how do people perceive their services that they had at the health department, and making sure that that's a positive experience. We want to make sure all of our clinics have offered telemedicine and telephonic appointments. We've started that in COVID and has been really, we've gotten some good feedback from clients about that. So we want to continue with that effort. And then we also want to increase our outreach services. So you'll see that as we talk about flu just coming up in just a moment, but having an opportunity to do more outside of our building and provide more services, including mobile services out in the community, especially those that are not necessarily in Fayetteville. And then the third goal under this piece about increasing community access is really about our access to the health department. So explore expanding hours of explorations. We're not sure quite what that will look like, but that was something staff was interested in. Making sure that we are doing referrals for mental health and NC Care 360. Some of these are duplicates because they cross over with some of our other measures. But you'll see the more about the caseload here, making referrals, and then scheduling appointments online. So those are all things that cross over with others, but are really about accessibility to the health department. So I'll pause there to see if there are any additional feedback that the board has, and then we'll talk about next steps.
And I tell you, it sounds like you've done a fantastic job planning this out. Well, I'm looking forward to the upcoming year. Sounds good. It sounds like you have a good plan.
Yes, our team worked really extremely hard on this. They were really thoughtful, got a lot of staff feedback. And one of the things that the strategic planning team, we wanted to make sure it was representative of not just senior leadership team or management team, but staff that are doing the work day to day. And so they worked really hard to get people on the team and then provide feedback.
Yeah.
So if you have any other comments, you can certainly email them to us. Right now, the work of the team the next month or so is to take all of those goals, objectives, strategies, and then talk about, hey, who's doing this now? And what resources do we need to actually do it? And who's responsible for making sure it happens? it can't all be, Dr. Green's going to do this. It has to be the work of the staff as well. So they're doing that piece now, and then we will have the strategic plan ready and drafted for your review and public input no later than January, and then it'll be ready for publication in February. Some of them, the goals and objectives, we are already going to start on, but we want to make sure that we have it in our public-facing document ready by February. Any final thoughts before we move on?
Is this something that we have to have public comment on too?
So we do need to get public input, and so we hope that folks can provide comment on this meeting, but we'll also have it posted on, once it's done, we'll also have it posted on our website, and people will be able to can email us their comments about it at any time. And then we'll also do an annual report for this. We'll do quarterly updates at this meeting for the board, and then we'll do an overall annual report that will be a public-facing document as well, so people at any time could provide feedback.
Very good.
So the next thing is our flu clinic updates, and I don't have any particular slides for this, but I wanted to thank the board for doing our special meeting last 2 weeks ago for the fees. The reason we needed to do it is because we needed to get on the commissioner's agenda, and the timing of this meeting. The commissioner agenda meeting was last night, and so if we waited to tonight, we'd have to wait another 2 weeks into November to get our flu shots approved. So we appreciate you guys coming together for that quick meeting. For flu this year, what we're planning, starting actually today, individuals were able to come into the health department by appointment only for flu and get a flu shot, no out-of-pocket cost for them, as we mentioned. So that kicked off today. And that's their first option to get a flu shot from the health department. Anybody, even if you're uninsured, will be able to get a flu shot at no cost. But the critical piece to that is by appointment only, so that we can socially distance in our lobby. I was down there this morning, and our lobby's already filling up. So we need people to call for an appointment so that we can space people out and not have everybody crowded in the lobby. And then the second way is we're planning a series of outreach flu clinics over the month of November, and then potentially into December, with several partner agencies. That will either be a drive-up flu clinic, or will be a socially distanced in-person clinic, but outside of the health department building, so that we can provide them updates about, or provide them a flu shot. We're also doing some radio ads and some other digital ads that we're going to be rolling out here in the next couple of weeks. So that's where we are with flu, and we'll provide an update on how it's going at the next meeting. Two other quick updates for our Healthiest Cities and Counties grant. That was one that we got awarded by Aetna in July. So we're ready to implement that. We are hiring a community liaison position for that, and that's a temporary employee. So we just finished interviews on Friday for that, and so we'll fill that position. And that the purpose of that grant again is to address healthy eating and food access in our community. So we'll get ready here in a couple of weeks to roll out these regular monthly meetings for that grant. And then finally, our Gen X update. Kelly has sent you a few things over email about Gen X, so I hope you're getting those. This year, I want to provide one quick update, similar to what they did last year. The folks that came, Dr. Hoppin, that came back pre-COVID, I think in February, to talk about PFAS, has also got funding to do a study and looking at their blood and how PFAS interacts with COVID. And we'll be rolling that out at the health department in December. So they'll be doing some additional blood collection, and then running samples on that to further their studies on Gen X. So we will participate in that. It'll be on 2 weekends in December. So we will get ready to help them implement that. They're doing the heavy lifting, doing the sampling. We're just sort of on site to help and promote the event as well. So we'll provide the board an update once that study has been implemented. And those are all the updates that I have.
Very good. So the next would be the, I guess everybody look over their roster. Anyone have any comments about what was presented or future topics for the meeting?
Just Sam Flashman, just a comment. Certainly want to commend the team and certainly Dr. Green on all the great work they've done throughout this pandemic, along with everything else that's ongoing for our county health department and the health of our community. So just to be commended in the times that we're in and the work that you're doing.
Thank you. I appreciate that. I always say this, and I don't just say it's meaningless. It really is a team effort. We are so appreciative of the work that our team at the health department is doing. They're doing it every day. So I know they're tired, and so, but they're doing this right alongside us.
Wonderful.
So I think the next step is everybody else gets to leave, in the room, but the board is the closed session to do for the personnel matter. Oh, sorry. Dr. McMahon, are you muted?
Yes, ma'am. You need me to say something?
Oh, no. Okay. We thought you were going to talk. Okay.
Oh, I was just going to say, so now we're going to go into our closed session for the personnel matter pursuant of North Carolina General Statutes 143-318.11A6. So those who are not a part of the board, if you would leave the meeting. So now just our board members.